Theodore Roosevelt says, "It's not the critic who counts, not the man who points out how strong the man stumbles, or where the doer of deeds could have done them better. The credit belongs to the man who is actually in the arena, whose face is marred by dust and sweat and blood, who strives valiantly, who errs, who comes short again and again, because there is no effort without error and no shortcoming, but who does actually strive to do the deeds."
Relentless, commonly defined as oppressively constant, determined, showing no abatement of severity, intensity, strength, or pace. I believe relentless is an ethos. You're not stopping until you get what you want. You're not taking no for an answer. No obstacle will deter you from your goals. Relentless mentality is where we get to tap into the mindset of change agents, leaders, and icons. My hope is that their stories will inspire and motivate others to transform their mentality in their profession, their personal life, and ultimately their communities. So remember, when it's tough, will you give up or will you be relentless?
I'm really excited to have April Rhodes from Spectrum Healthcare Group here today. Welcome, April.
Thank you for having me.
So April Rhodes is the CEO of Spectrum Healthcare Group, a leader in providing structurally integrated care to its community members. She's considered an expert on topics relating to integrated healthcare, value-based purchasing, access to mental health care, and community-based services. April attended the Arizona State University and received a Bachelor of Science in Family and Human Development and a Master of Advanced Study in Marriage and Family Therapy. April draws on her therapy skill sets, open communication, and business management, all while balancing vision and risk in this ever-changing healthcare landscape. April also serves on the Yavapai County Board of Health and the Board of Directors for the Arizona Council of Human Service Providers. So we have a lot of stuff going on in our state, April. We have like 30 days to the largest transition of Medicaid ever. I've always admired the work you guys have done up in northern Arizona, and I feel like our paths have been running parallel for a certain amount of time. So thank you for coming on. And
thank you.
Hoping you could start with some of your story. You have a really awesome story and a background of how you got to be CEO of Spectrum. And I didn't know if you could share some of those pieces and we could talk a little bit more about kind of your mindset and things you guys have going in the future.
Sure. So you want me to start at the beginning?
Sure, wherever you want to start.
So I was actually born and raised in El Paso, Texas. Spent some time in Odessa and Albuquerque, but mostly El Paso. And did a lot of moving around as a child. I think I went to no less than 8 elementary schools before settling into a little outlying community of El Paso called Canutillo, Texas, which is a predominantly Hispanic community, and I was one of the only white girls in that community. And I don't recall that as being a negative in any sense. And in fact, I think it was. I look back very fondly on that time because I was really kind of enveloped into the family community there. And Hispanics have a large value on family and community, and so I always just felt really included, and I really enjoyed that time. And certainly there was adversity there with being made fun of for being white or trying to speak Spanish. I always tried to speak Spanish. I can understand Spanish. People don't know that. So that's kind of served me well as a strength.
Yeah.
But then, from there, I, very young, became pregnant at 18 years old. And then again at 20. And so around that time, I got married, moved to a completely different state, and had a child within about a 6-month period of time, all before I was 21 years old, which is basically the recipe for if you don't want things to work out in your marriage, do all of those things. So it was a lot all at once, and we were very young, and so that quickly ended, and then I found myself to be a single mom of 2 young children, very young. And I always kind of threw that, a theme for me from as far back as I can remember, is that I always wanted to be in charge. And I've been called bossy a lot, and I'm sure you're not surprised. And so, in good ways, bad ways, whatever, but I always wanted to be in charge of things, and I always was fascinated or intrigued by how things worked, and so we quickly get into whatever situation. It doesn't matter if it was a work situation or family situation, and try and figure out how that worked, and then learn as much as I could about it. So inevitably I would find myself also promoted. So I was always kind of running things. And then when I went to school, which was an achievement by itself, I didn't consider that college in any way, shape, or form was a possibility for me. So it was kind of a distant dream. But fast forward, I went through those things and became a therapist, and then started at Spectrum, which was then Verde Valley Guidance Clinic. We've gone through some rebranding. But even in the course of being a therapist, I was fascinated and drawn to the CEO of the company. And I saw how he handled himself, and I saw how people respected and listened to him. And I somewhat, looking back now, somewhat boldly said to him, I want to be you. I want to do what you're doing someday. How do I do that? And I think he was a little taken aback at the time because he thought maybe like I wanted his job, which looking back now, I guess I did, but I didn't think it was going to happen that quickly. And so he remembered that. A couple of years later when it was time for him to go and he was really looking around for the next leader, and we were coming up on some changes in the system then with the regional behavioral health authorities integrating, and he knew it was going to take a special kind of leader, and he remembered that boldness and came back to me and said, how serious were you about that? And so then we went through a development plan, succession, and all of that, and here I am.
Right place, right time.
Yeah.
And putting in the effort. So, we're both in the mental health business, and both my parents are mental health clinicians. So most of the time I find that, and I tell my team this all the time, the most valuable asset in any healthcare company is the clinician who also understands the language of business and has business acumen. And so how were you able to get over that and learn the language of business coming from the marital and family kind of therapy side and being thrust into that role? How was that? How did you do that?
Well, I think actually the way I was able to do that is that the business side came first for me. And so while marriage and family therapy is my clinical training that's allowed me to move up and advance in this particular industry, long before that I had been working in various industries learning the business side of things. And what I found in systems is that the process is always the same. The content may change of what you're doing, but if you went from manufacturing widgets to manufacturing services of some sort, the process behind that is the same. And so I brought the business acumen with me into that role. So it was pretty easy for me to take a look at the clinical side of things and learn enough about that to be able to oversee people doing that work, but to see that there was this huge gap in exactly what you're saying. People were being promoted into these roles where they needed to run a business, but they had come out of a clinical environment, and so it was difficult for them to make that leap. And I saw an opportunity to help them see how the business supported their
Can't have
their
one
heart.
without the other.
Yeah, exactly.
So what advice would you give to, either way, whether it's the clinician going into business or the layman going into clinical? What advice would you give them on how to become successful in that environment in the future?
I think, it's really even beyond that and more that to be successful in any sort of endeavor that's difficult, especially, is to consider different perspectives. And one of the things I learned in becoming a CEO, relatively, or young CEO, and female and all of these different things, is that it was important for me to really listen to other perspectives and what people were saying, and to be willing to change my mind at times. And so I think regardless of what you're trying to do, you've got to avail yourself of all of the information. And too, from running a company, that we're trying to make decisions with sometimes very little information. Some of it's based on intuition, and you've got to be confident in doing that. And the way to get there is to consider all different perspectives, even if they're in conflict with your own, and to be willing to be surprised sometimes that it's not the way you thought it was.
Yeah.
And be humble enough to shift.
So that's a form of bold leadership. Where does that stem from? And I ask this to almost every guest is, there's this whole conversation about it's genetic or nature versus nurture. Where do you think that stems from for yourself? Where did you get that bold type of leadership and that work ethic? You were the young mom, going through these different industries, pushing your previous CEO to say, hey, this is something I want to do. Where do you think that came from?
I think that stems from two different places, and I really want to make sure I mention both because I think they're incredibly important. But the first place would be from my mother, for sure. My mother is one of the hardest workers I know, and she's one of the strongest people I know. And I recall from as far back as I can remember that she worked hard. She knew early on, she was a single mom like me, early on with my brother, who is 8 years older than me and has since passed away. So she's buried a child, which is incredibly difficult.
Oh, sorry.
But she just always worked hard to make sure that we had what we needed. But what I recall about that was that she was never absent. I always knew she was there. Even though she was working a lot of hours, I always felt loved. And her and my brother told me from a very young age that I could do anything I wanted to do. And so I believed them. They never qualified it and said, you can do anything you want for a woman, or you'll do a lot of things when you're older. It was just, you can be whatever you want to be. Yeah. Just set your mind to it and work hard, and with a little bit of luck, and if you're good to people and you keep your word, then that will work out.
Sure.
But the second piece of that for me really comes from a more vulnerable place, I think, in that I experienced significant loss over and over and over from, during very formative time of my life, from about 11 to about 20, just through deaths in the family, through my parents' divorce and the changes in relationships that came with that. And I remember feeling like, while people might leave me, whether through death or, those types of circumstances, it was never going to be because I didn't give it all I had. Yeah. And it was never going to be because I wasn't enough. And that's the kind of fire, I think, that burns in somebody that can make you do pretty amazing things. You may not even know it's there, and I've had to think really hard about that. Yeah. But to be a therapist, you have to do the work of therapy, which causes you to have to reflect a lot and be really honest about what's driving those things for you.
Yeah, that adversity is so key, I think, too, in the future and how you are as a leader. And so, I think that's so pertinent to people listening to the podcast in terms of the relentless mentality, right? Your adversity is actually going to help you set up for success in the future. And so that's a great example. Thank you for sharing that. So switch gears a little bit. So you were a marital family therapist at Spectrum. You talked to the previous CEO there and became promoted as CEO. What was the biggest obstacle or moment of fear or barrier that you had in that transition? I know that had to be a unique transition for you, and so can you share some of that?
Oh, sure. I think the biggest obstacle that's also an advantage I see now, mm-hmm. I didn't at the time, but I still experience it today, is that people underestimate me. Yeah. Sometimes because of the package I come in, potentially, that I'm young, female, whatever. I've never thought of those things really, because like I said, it was never relayed to me that could be a barrier, but I experienced it for the first time when I became a CEO, that people didn't necessarily see me coming. And so at first that felt like a barrier, an obstacle, but then I learned to really embrace that, because sometimes it's good when people don't see you coming. So that, there was this aha moment for sure in the transition, and we did this very interesting, kind of transition of power where we announced that I would be the next CEO, but had never been a CEO. And so it was important that we gave the organization some sense of stability around that. He had been the CEO there for 15 years, been at the company for 25, and so obviously there was some anxiety around that shift. So we decided we were going to do a development plan together for about 12 months. I would be the deputy director, work under him kind of as like an apprentice, and go through the motions of what does a CEO actually do. So we were doing a lot of that. In about 8 months, he told me, I'm going to be done sooner. We don't need 12 months. You're ready. And I had this incredible sense of panic about that, because I kept thinking, I'm not like you. I haven't learned how to be you. If I'm going to be the CEO and be successful, I need to be you and do things how you do, and I don't know how to do that. And I had this epiphany of sorts, kind of sitting at the boardroom table for the first time thinking, I don't have to be him, I have to be me. And it was very liberating, and that these people who had hired me in this process I had gone through had uncovered the strengths that I brought to the table. They weren't looking for another him. They were looking for what I had. And so from then on, it was literally like a burden lifted from my shoulders, and I was able to really develop my own style of CEO leadership.
And being authentic, I think that's one of the things that comes across, right away when I first met you. You were certainly authentic and passionate and understand exactly what you want to do with the model of integration, and I think that's really admirable. So, okay, so switching gears for a little bit again. Tell me a little bit about Spectrum, because I think folks watching this to kind of understand what you guys do and what is the business and how do you serve the Verde Valley area and Yavapai County.
Spectrum is a whole healthcare provider. We serve the Yavapai County now. We started out in the Verde Valley and have expanded our whole health model to be fully structurally integrated across all of our sites. We have 5 sites now. And so what I mean by fully structurally integrated is that people coming into our doors are able to avail themselves of physical health, behavioral health, pharmacy, laboratory, immunology. You know, we're always looking for ways to vertically integrate as well, because I think that it's important to craft the healthcare delivery to what the patient value is in that community. So it's not a one-size-fits-all, you know, model of integration for us. It's really about what makes sense in our communities. And we recently acquired a practice in western Yavapai County so that we can expand into that area, because I believe that all people can benefit from the whole health model. And my passion, really, if you get me started about it, is around, you know, making healthcare be an experience that considers the patient value. Because I think so often it's one of the only industries where you kind of just leave the consumer out, and you know, and you really consider it. And a person is really at the mercy of what other people think is best for them, whether that be from a treatment perspective as a provider or from the payer perspective for what they'll pay for. But the consumer, who really is the greatest expert on themselves, has no place in the conversation. And so it's my passion to make it be where people can access the kind of care that they want, when they want it, where they want it, how they want it, regardless of what their pay source is, you know, regardless of what population they live in, even if it's in my little corner of the world, even for just a little while. You know, if we can provide that kind of care enough so that people can see that that's what needs to happen. And then also making mental wellness a part of the conversation very early on. Instead of, let's wait till there's this huge problem, or, you know, we're all suffering. Why aren't we talking about it? I mean, you have a young child. Why aren't we talking about it at every well check? You know, and starting to make that a part of it. Yes, because then it would normalize the conversation for people very early on. So that's what we're trying to do at Spectrum, is make that, and it is an uphill battle, as I'm sure you know, because it's a paradigm shift. And so that's what we're doing.
What's the biggest obstacle that you guys have overcome that was kind of a aha moment for you in this transition and doing integration and bringing these services all together?
Well, I don't know that it's an obstacle we've overcome.
Okay.
But one of the largest obstacles that we're constantly working on is getting, even internally in our own organization, buy-in to what I just described. You know, getting providers to think, to understand why we want to see people same day or in 2 weeks or whatever it is that the patient wants. How do we provide that service to them right then? Getting buy-in into that access to care mentality, you know, not because I'm mean or not because Spectrum is trying to make their lives difficult, but because it's the right thing to do, and that's what people want to experience, you know. So we're still working on that.
Yeah. So again, a lot of parallels we have. This actual podcast we're on right now was a evolution of our, what we call the relentless pursuit of a better patient experience. And so every single employee that comes through Bayless goes through an NEO presentation, new employee orientation, where we talk about that relentless pursuit and changing the paradigm of the patient being just an end user who has no say in what they do, and how every single person in this company, whether you are a clinician or a office assistant, has such a important, impactful job to impact that patient experience, and that if we all had a relentless mentality or relentless pursuit around that, we could really change our entire community. And so I totally understand and respect where you're coming from with that, and I think it's very few people though talk about it now in healthcare. You know, healthcare for so long has been about the shingle on the door, and you're going to come to me because I have this specialty or I have this, and you know, if you have to wait 45 minutes to an hour or hour and a half, that's fine. Or if you have to wait to see me for 3 months, you know, that is what it is. And I think that totally has to go away.
I want to change that.
Yeah, and I think that's, again, where our parallels are. So, okay. So moving on. So let's talk a little bit about advice, right? And I think 2 things I would like to touch on, because I think people in our sector are going to watch this and listen to this. And what advice would you give them if they are right now staring at 31 days from the launch of Access Complete Care, which is the largest transformation of the state Medicaid system, and they have to become integrated very quickly? What advice would you give them to move towards a system like you have? And the second thing is, what advice would you give to somebody that wants to become a CEO in their organization, has those aspirations, and is looking at doing something bold?
Well, I think one of the biggest things that people have to do, especially in our industry right now, is to, rather than continue fighting, I think there's two ways you can go with it. You can, see yourself as a victim of the system and say, oh, what are they doing to us? And let's just, fight back. Or you can take a leadership mentality of, okay, this is our reality. This is where it's going. Let's try to understand why that is and how can we make that better? And how can we join forces and collaborate and work together to actually achieve that end goal of complete care? And, I believe 100% in where Access is trying to go with this. And so I have complete buy-in. Obviously, we've been on the road trying to do that. We've seen that it's better care.
Sure.
And so that's
Better
part
outcomes.
of why I believe in it.
Yeah.
And
lowering cost. I mean,
yeah, there's so much that's there that's just good, and if we can all kind of help each other get there. So I think we've got to shift into that leadership lane, that leadership mentality of how, in what way can I do this, instead of this is too hard or why are they doing this to us, and just take charge of, this is a business, and let's take charge of it, and you tell them why, and you know your cost, and you make sure that you can explain the value of your care versus someone down the street. And if you can't do that, then that's telling all in and of itself. Yeah. And then on the individual level, my advice is to be bold. I think to put yourself out there. I think often people are waiting for opportunity to come to them, and there's very little to lose in seizing it and putting yourself out there and saying, kind of like the man in the arena. That quote speaks to me because I've been in the arena with dirt on my face and feeling like, why am I doing this? And I just want to quit. Yeah. And when I heard that the first time, I thought, oh my gosh, I'm actually, at least I'm trying to do something. Yeah. I may not be doing it well, and I may fail, and all of these things may go wrong, but at least I'm out there trying to do something different. What are you doing?
Yeah.
Kind of mentality. So get out there, get out there and do things, and they're not all going to work. I think embracing the fact that it's going to fail and that there's a lesson in that failure, and soak that up and take it with you. But be bold about it.
If you would say you had one single secret, and I'm still poking at this because I want to try to get it out of you, to your integration. So what is the kind of special sauce or secret to success you guys have found in kind of doing integration thus far? And so somebody that's watching this that is, maybe a primary care physician who has a small practice, or it could be another behavioral health leader, or a hospital system, or an insurer who's looking at how do I change the way that we contract. What would be the single secret of success that you would share about doing integration?
What I believe has made us successful is that we've done it ourselves, but that may not be what you're trying to get.
No, I think it is.
Being fully structurally integrated, meaning that it's one company. Yeah. And when you're trying to, and again, I hesitate to say that as the end-all be-all, because there's not one way to do it, I think, and any integration is, in my opinion, better than none at all. But I think the secret for us has been that we're one company with one mission. All of our providers work for us and are bought into that mission, and our differentiators are really around getting people in same day, no matter who you are, across all populations, across the lifespan, across all payers. This is the kind of care you can get here.
And so that's I think what I was trying to really get out, and what I really respect about you guys, and I noticed from day one, just the way that you and your team talk about things, is a culture, right? If you don't have the culture established for integration, I don't think it's ever going to work. And I think what you're just talking about is, if the culture is not owned, it's really hard to keep people accountable, right? And understand all these things we talked about, the patient experience. And I think you guys symbolize that so well up there. And like you were talking about earlier, the difficulty of getting providers in rural Arizona and getting them bought into this model, you have to have that culture, and that starts at the top. And it really starts with your kind of bold leadership and being able to think outside the box and say, no, we're not going to do this the same way we've always done it for 25 years. We have to completely get rid of that and try something new.
Man, that's hard.
Yeah, yeah. So, okay, great. So wrapping up, we always ask kind of 3 lightning questions. So what are you the most proud of? I'm extremely proud of the people that I work with, and personally, obviously, I'm very proud of what I've accomplished and the example that's set for my children, not just my biological children, but children that I've helped raise or adopted informally along the way. I'm proud that sometimes they say that I've inspired them, and I want to be worthy of that.
But at Spectrum, I'm definitely proud of the team that's come up behind me that really embraces that culture that we're trying to foster in the company, and is just all in every day trying to make it happen, even though it is literally an uphill battle sometimes. And so I'm really proud that we've inspired that kind of collaboration in the company, for sure.
So who inspires you now? I know Theodore Roosevelt, that was your quote, by the way, everybody. That was April's quote. I loved it, so we used it earlier. Who else inspires you?
Oh, that can't be a lightning round question. I'm just inspired. I feel like it's a state of, I'm just 90% of the time inspired by all these things all the time around me. But, and I draw a lot of inspiration from all the regular places that, people might say, from past presidents, from world leaders, from different leadership scenarios, but really just in the everyday leadership you see demonstrated in the world, if you're paying attention. The fact that people do things even when they're hard, because they believe in them and they stay committed to that. I'm inspired by doing things out of the box. I think I told you I was inspired by the fact that you're doing this right now at this time and really trying to hone in on that relentlessness that gets you where you want to go. That's inspiring. I'm inspired by the director of Access, who's making this work and held on to it patiently for years. I need to learn something from that because I'm not a patient person. And so I draw inspiration from that, like, okay, if I just kind of wait, then someday this will work out. But it's just everywhere you look.
Okay.
For me.
Okay. And last question. So what motivates you now to get out of bed in the morning?
That's a good question, because sometimes it's really hard to keep kind of, trying to chip away at this. But first and foremost, the belief that my family, my husband, my children have in me to make this happen and to do the things that we're doing, my passion around healthcare, my passion around the underserved, mobile crisis, decriminalizing mental health, all those things are really hard, but they all believe so much in me and are looking to me to be that leader, and it inspires me and motivates me to be what they think I am. And I see them kind of looking up to me, and I'm humbled by that whenever I take notice of that, because it's so amazing to me that people are seeing me as a source of inspiration when I had so many people that were inspiring to me. But I take that really seriously. I think that's a big responsibility, and I want to be worthy of it, and that motivates me to be my very best. I don't do everything I do, I try to give it everything I got, whatever it is. So.
Well, you certainly inspire and motivate me. I think
Thank you.
We watch what you guys are doing in Northern Arizona, and I think it's unbelievable. We're rooting for you guys. I think all of us want to see the same things. We want to see a system that's fully integrated that makes it better for patients, and so.
Yes, and likewise, we're similarly motivated and inspired by what you're doing as well.
Well, thank you. But thank you for coming on. Thank you for sharing your story.
Thank you.
And I hope we can stay in touch and continue to work together.
Absolutely.
Thanks.
Thanks so much.
All right.
Thanks for watching. If you enjoyed what you saw today, please subscribe in the links below. And remember, never to quit, always be relentless.